Hello, my name is Rita Jablonski, and I'm a nurse and researcher who was involved with improving the oral health of persons with dementia. The objectives of this video are to first help nurses recognize care-resistant behavior in persons with dementia. Second, use research-based interventions to prevent and minimize care-resistant behavior in persons with dementia. And finally, to provide evidence-based mouth care to persons with dementia. Why is oral health so important? Oral hygiene is extremely important because the lack of it predisposes all people, especially older adults, to caries, plaque on teeth and dentures, and periodontal disease. Older adults are more likely to develop plaque on their teeth and dentures because of reduced salivary flow. Salivary flow is affected by medications, and the average older adult in a nursing home is taking at least 8 medications. There is emergent evidence linking poor oral health and its consequences with pneumonia, specifically nursing home-acquired pneumonia, cardiovascular disease, poor glycemic control, and urinary tract infections. Some researchers dispute the link between oral health and urinary tract infections, citing dependence on others for care as the real link between both. However, other studies have examined the correlation between periodontal disease and UTIs, controlling for functional dependence, and the association remains. Finally, there are associations between poor oral health and, not surprising, weight loss. Let's take a look at how mouth care is all too often provided.
Good morning, Evie. My name is Terry. I'm your nurse's aide for today. Come out from under those covers now. Time to brush our teeth. We have a big day. Come on, Evie. Let me brush your teeth. Open up.
No. Stop. Oh, help. Are you crazy? Why are you trying to kill me?
Evie, come on. Stop it with the games. I have a lot of people to take care of today. I just need you to let me brush your teeth.
Go away.
Come
Leave
on.
me alone. Help. Help.
Come on. Just
Call the
open up.
police. You're hurting me.
Evie's refusing mouth care. I don't even know what to do. I'm just gonna have to go on to the next person.
That happens with these older adults. They're always refusing to brush their teeth. Don't worry about it. It happens. You tried.
Without realizing it, the nurse created a threatening situation. The elder was not refusing mouth care. Instead, Evie was trying to defend herself against a perceived threat. I am now going to show you how to approach an older adult with dementia in a minimally threatening way, and will also show you strategies you can use to provide mouth care without creating a battle. The reasons why older adults with dementia resist care can be found in the human brain. As an evolutionary survival tool, we are hardwired to perceive threat and respond with fear to certain images and situations. The most common are snakes, spiders, and heights. The amygdala is emerging as the center of the threat perception universe. The amygdala stores and moderates memories of threat. When threat is perceived, the fear response is activated, the flight, freeze, or fight response. The fear response has both autonomic pieces, elevated heart rate and sweating, and behavioral components, the freeze, flee, or flight. Usually, other parts of the brain interact with the amygdala to explain whether or not someone or something is really a threat. For example, I may be afraid of spiders, especially big, hairy tarantulas, I now see a spider crawling on the floor. Before my amygdala swings into gear, other parts of my brain calm it down with reason. That is a daddy long leg. It is 20 feet away from you, and it cannot bother you. My brain settles down, and I continue with my lecture. This entire process takes microseconds. When a person suffers from dementia, the brain no longer functions normally. Persons with dementia are more likely to become fearful and see danger in non-threatening situations. Also, they have difficulty recognizing emotions. They are better able to recognize positive emotions rather than negative emotions, which explains why persons with dementia are less likely to resist care from smiling caregivers than from non-smiling caregivers. There is an entire toolbox of strategies that nurses and caregivers can use to prevent persons with dementia from becoming afraid during care and resisting care. One of them is to smile and look friendly while interacting with a person with dementia. The way we approach someone with dementia may cause fear and cause the elder to push you away and resist care. Your closeness or proximity may be interpreted as a physical assault to their person, a physical threat. Many persons with dementia are confined to wheelchairs or have limited mobility, so the option to run and remove themselves from the threat is not available to them. Instead of flight, the fight response kicks in. This fight response may be seen initially as refusal behavior, such as turning away or closing their mouths. As you continue to try to provide mouth care, the care-resistant behavior may get worse. The residents may try to push you away and may even hit, bite, or yell as they attempt to fend you off, the perceived attacker. When providing care to a person with dementia, make sure the environment is free from clutter. Turn off any sources of extra noise, such as radios or television sets. Approach the older adult in a relaxed manner. Otherwise, the person with dementia will pick up on your harried or hurried demeanor and may become anxious, which increases his or her perception of you as a threat. Move smoothly and speak slowly. By moving smoothly and speaking slowly, you are conveying to the elder that you are not a threat. Introduce yourself using a lower-pitched voice. As people age, they lose the ability to hear higher frequency tones, otherwise known as presbycusis. Keep your facial expressions pleasant and welcoming. Persons with dementia, depending on how severe the dementia, rely heavily on affect, how you come across. Persons without dementia may use multiple cues and sources of information to process the situation, whereas persons with dementia are less interpretive and will take things at face value. Avoid elderspeak. Elderspeak is a communication style that has been shown to cause care-resistant behavior. Elderspeak involves the tendency to speak to the older adult as if you were speaking to a small child. That is, speaking with a sing-song cadence and substitution of singular pronouns with plural pronouns. For example, are we ready for mouth care? And inappropriate terms of endearment, such as dear or honey. The nursing assistant in the first video clip engaged in elderspeak. Do not tower over the older adult. Crouch down and stay at or below eye level. This will make you appear smaller and less threatening. Touch can be tricky. If you do touch someone, keep it gentle and start at points furthest from the body, such as the hands. If touch seems to reassure the elder, you can move to the arms and the shoulders. If the elder has visual or hearing impairments, make sure glasses are clean, not smudged or dirty, as this will distort his or her vision. If your elder uses a hearing aid, make sure it is functioning properly and properly placed in the ear. At this point in the video, I'm going to discuss best mouth care techniques. I will also provide ways to prevent or reduce care-resistant behavior while providing mouth care. You will need these materials: gloves, soft toothbrush, toothpaste, clean towels, cups, mouthwash, inner dentate sticks, and warm water for rinsing. The best place to perform mouth care is in the bathroom, or at least in front of the sink. The environment is an important cue to help the elder understand what is going on. Items such as a sink, tile, and running water may prompt memories and help the elder to participate more in his or her mouth care. Other cues include the toothbrush and toothpaste. If the elder participates in his or her mouth care, you will be less of a perceived threat. If able, have the elder stand in front of the sink to perform his or her own mouth care. If not, place a chair or wheelchair before the sink for the elder to sit in. Another strategy to prevent care-resistant behavior is to allow the older adult to do as much of his or her own mouth care as possible. The older adult has no problem placing a toothbrush in his or her mouth. The older adult may feel threatened if you try to do that. Always set up the materials for the older adult and assist before actually doing mouth care. If the elder has visible debris on the teeth, have him or her dry brush first. Use the toothbrush without the toothpaste. Provide the older adult with warm water to moisten the toothbrush. Many older adults have receding gums, which expose the roots of teeth and create sensitivity to cold temperatures. Cool or cold water can cause pain. In persons with dementia, the pain may result in care-resistant behaviors. Brushing without toothpaste also allows you to visualize the removal of debris, which may be obscured by the foam from the toothpaste. You may skip this step if you do not see debris on the teeth. Do not make a big production out of this step. If the elder does not respond to verbal cues, use pantomime and gestures. That is, keeping yourself at or below eye level, mimic brushing your own teeth. When helping the older adult with mouth care, give directions using simple but respectful one-step commands, such as "spit please." Allow time for the elder to respond. Hurrying the elder along will precipitate care-resistant behavior. Also, avoid interruptions, which may overwhelm the elder and initiate care-resistant behavior. Sometimes, the older adult may not understand verbal commands. Depending on the extent of the dementia, the elder may not understand "brush your teeth," but will start to brush his or her teeth if a toothbrush is placed in his or her hand. You can further reinforce your request by gesturing and pantomiming. Gesturing and pantomiming are very effective communication techniques when working with older adults suffering from dementia. Allow the elder to brush his or her teeth as long as he or she wants to do so. If brushing exceeds 2 minutes, stop toothbrushing by changing to the next task, brushing the tongue. Once the teeth and tongue have been brushed, rinse with 30 cc's of tepid or warm water. As I've mentioned earlier, ask respectfully in short one-step commands to please spit. One-step commands have been shown to reduce care-resistant behavior. Allow time for the resident to respond before completing the task. Some persons with dementia may need their mouth care performed for them. If you must perform mouth care for the elder, place your thumb between their lower jaw and lower lip. Put the toothbrush at a 45-degree angle on the outside of the lower teeth first. Brush from the outside lower to the outside upper. Ask the elder to open his or her mouth and brush the inside upper to the inside lower. Brush the inside lower teeth last in case you accidentally elicit a gag response. For flossing, the best method is to use interdentate sticks. They are white plastic toothpicks with little spiral Christmas trees on the end of them. These kind of interdentate sticks work the best. The nurse can ask the elder to pick or floss. Both terms work equally well.
Pick in between each tooth. Great.
Allow the elder as much time as needed to pick the teeth.
Okay, I'll take that.
You may need to guide the elder's hands to make sure the interdentate stick is moved in between each tooth.
Say E.
E.
And then
Even if the older adult clenches his or her mouth, you can still floss with the interdentate sticks
Great.
while he or she says E. Conclude mouth care with mouthwash. Alcohol-free mouthwash is the best to use because it does not burn sensitive tissues. Have the elder swish and spit out the mouthwash. Always remember to praise the elder in an adult-like manner throughout mouth care. If the elder requires assistance and is in a wheelchair or chair, another helpful technique can be employed to prevent care-resistive behavior. Approach the resident from the side and cradle the person's head in your hand while guiding or assisting with toothbrushing. Another variation of this technique for someone who does not open his or her mouth is to stand behind the older adult so that he or she is looking directly in the mirror. You can brush the elder's mouth from behind, watching your hands in the mirror. This technique is challenging and requires some practice. Let's go back to the earlier interaction and see what would have happened if the nursing assistant had used these techniques.
Hello, Mrs. Johnson. Hi, Mrs. Johnson.
Hi.
Hi. I'm sorry to wake you up. My name is Terry. I'm going to be your nurse's assistant today. I was just coming by to see if you wanted help brushing your teeth. If you want, I can help you do that. Good morning. I think you'll probably be more comfortable if we brush your teeth in the bathroom. I can help you out. Okay, Mrs. Johnson, are you ready to brush your teeth? Here you go. Yep, just brush. Good. Here, just come right back down here. Good. There's some water.
That's too cold.
Oh, here, I'm sorry. Let me make that warmer for you. Sorry, Mrs. Johnson. Here you go. Swish and spit that out. Good. Here, I'll take that. Okay. Now we're gonna floss with these Christmas tree toothpicks. They're like little Christmas trees. Here you go, and you're just gonna pick your teeth. Say E.
E.
And then pick in between each tooth. Great. I'll take that. Let me give you some mouthwash. We'll swish it and spit. Okay. Great Great job, Mrs. Johnson. Are you ready for your breakfast?
As you saw, these very simple but general strategies work very well. There are other specific techniques you can use to reduce the perception of threat and provide mouth care to persons with dementia. When working with older adults who have dementia, you may encounter resistance and rejection of care as mouth care proceeds. The next part of this video will provide you with additional techniques that help to reduce care-resistant behavior. The first technique is distraction. Distraction includes talking, singing, massage, and objects.
I've been working on the railroad
Just past the time of way.
Talking to the elder about activities or hobbies, for example, playing the piano or golfing, about important people in his or her life, for example, grandchildren, or pets, may distract the elder from mouth care and reduce care-resistive behavior. Bridging can also work as a distraction. That is, if the elder needs you to brush his or her teeth and starts resisting, you may want to give the elder a toothbrush to hold while you brush his or her teeth.
No.
Okay, could you hold this for me? Just hold this 1 second. Okay. Can you open your mouth?
Chaining refers to starting the task and having the elder join in. During mouth care, for example, you begin the task by placing toothpaste on the toothbrush and then putting it in your resident's hand. This should trigger memories of brushing teeth, and the resident should complete the task of brushing his or her teeth.
Say
Hand over hand is an excellent technique for reducing care-resistant behavior. Place your hand over the resident's hand to guide the resident through the activity.
Here, just come right back down here. Good.
Sometimes one is faced with an elder who will not open his or her mouth. I have used a technique I call mirror mirror. Stand behind